Staying on the topic of healthcare, this just yesterday there was a deadline to get bills out of the House of Origin, which basically means if you got a bill that was in the Assembly, you had to get it out by midnight yesterday. If you was in the Senate, you had to do the same thing. And so one of the bills that was caught up in the state assembly was an assembly bill by an assembly member out of San Jose, a Democrat, and it's Assembly Bill 1400, which basically said that it was looking to get rid of private healthcare insurance here in California and replace it with a government-run healthcare program. Now, there were several years back, there was an estimation done as to what the cost of this would be. It was anywhere between $317 billion to $393 billion. In order to pay for this, they were going to obviously increase taxes on people making quite a bit of money. People making over $2 million would get a certain tax increase. People making over $1 million would get another tax increase. Businesses would get another increase. And then they had another provision for employees making over $49,000 a year. They would have their own little set increase. And so that's the way they were looking to pay for it. It was going through the assembly yesterday, and the author of the bill wasn't able to get enough votes for it to go through. Some Democrats were questioning whether this was the right time to raise taxes. I mean, in the hundreds of billions of dollars in new taxes. And the real big problem is there was a lot of questions as to, if you're replacing private health insurance, what are we going to get with this government-run healthcare system? And, credit where credit's due. The Los Angeles Times with George Skelton, a lot of other people really came out and said, you're just trying to rush this thing through without having a full debate. First of all, we don't know if this is even feasible, if it can even happen. We don't know what the financial stability of this thing may be, and yet you're doing it without any debate. And so, luckily there were some Democrats. All Republicans obviously were opposed to this, but there were some Democrats that said, hey, let's put on the brakes on this and let's wait.
I heard the bill sponsor on the radio, and he was talking about acknowledging basically they had never done a study or had any information or data that would show how much this thing would cost and how you would pay for it. So you're right. Kudos. Common sense. Maybe they put something in the water fountains up at the state capitol, or as we call them back in Rhode Island, the bubblers. That's what we call water fountains in Rhode Island, the bubbler.
The bubblers.
The bubblers. Maybe they put something in there that gave them a dose of common sense that stuck. But, I mean, if you propose some massive legislation like that and you can't even address how much it's going to cost or where you're going to get the money from, it's probably, a good idea to say, hey, time out, let's take a breath on this. But this will come back. I mean, it's very clear that it will come back. It will become, an issue probably in the next session. They probably will do a little more groundwork. They will have, maybe they do it through a ballot initiative or some other, combination of legislation and ballot initiative. But you hit right on the button. How do you pay for this? And, it's a state and federal combination. They probably would get help from the feds with this administration. But still, there's a considerable cost at the state level. And no one's asked the question, okay, are doctors who are already here, that already spend so much time on regulation, so much time on insurance costs and all this other stuff, I mean, are they going to want to stay here and continue practicing with that? Or do we see the quality of, another thing they never addressed, how does it impact the quality of healthcare that are given to people? So, it was somehow smarter heads prevailed there. I'm not quite sure how. I'm not sure what they put in the bubbler, but whatever it was, we ought to buy some at Amazon and put it in there more often, because it was a smart thing to let it die in committee right now.
Yeah, and two of the other areas that weren't answered that I just remembered is, so if you've got your private health insurance, what happens to it? Not only that, but what if you like your doctors? Will you be, forced into it? And we, another thing that you and I have talked about tremendously has been, over the last several years, the governor has increased the amount of people that can get on the state healthcare plan. And so what they have done is they've covered, more undocumented immigrants, for example. that can get on the plan,
Hmm.
on the government's healthcare plan. But the biggest concern, the biggest worry has been they haven't. It's not like they've increased it or made it easier for people to want to get into the medical profession. On the contrary, they're right now debating whether or not they should increase the amount of insurance that a doctor has to carry. Increasing the cost over to them for just being able to operate as a doctor, being able to be a licensed medical professional here in the state of California. You've also got, in addition, through the different unions, as to what the staffing ratio is supposed to be in the hospitals, which, some of the hospitals are saying, this is adding to our traditional costs, because that means we've got to, bring in more people, or shift the shifts of the nurses around. And so there's a lot of areas here in healthcare that is expensive. That, if you're looking to solve for healthcare itself, maybe it's trying to figure out ways to make it less expensive, not just throw away the entire system and go through a universal healthcare system that where it's going to cost us hundreds of billions of dollars just in
Right.
taxes themselves.
Well, and how does that fit into a national program? If you happen to live in California, but you work for a company that's outside California, the impact that that has on that company. I mean, we've seen that before. Even on agricultural things, they pass things in California that, all of a sudden the products that were coming in now have to meet this new standard. And as a result of that, what do you see? The price of goods go up. And you have people that are less, even though there's the one thing that California has that it still has is a huge marketplace. The rest of the business things may not be all that great. Insurance, workers' comp, taxes, all of those things may not be really good in terms of starting or building or bringing a business to California. But the one thing it does have on its positive side is a huge consumer base. But you have the same situation here, which is, what happens to people that are in California that have insurance from other states, work for companies in other states? How does that impact those companies? It's an extraordinarily complicated. Anybody would tell you. I mean, any side of the aisle would tell you how extraordinarily complicated it was to even think that they could do this quickly, and to think, to your point, I'll look at it from the negative Nelly side of it, shall we say, the people that voted for it. What are you thinking? I mean, what are you thinking? I mean, so you like the concept of universal health care. That's great. But you still have a responsibility as an elected official to do the homework that says this is how we get this done. This is how we address this issue or that issue or this regulation or this shortage of doctors or what may happen because of it. They didn't do any of that. But a lot of those people still voted for the stupid thing. People in those districts should take a look and wonder, why are you there? Because something that's that complicated can't be done that quickly,
All right, and
even by smart people.